This is Akashvani. In the program Insights, now we bring you a discussion on importance of food safety and hygiene, issues and solutions. The participants are Indra Chakravarti, public health expert, and Ramya, anchor.
We often see and hear major issues get highlighted and hit the headlines of newspapers and news channels, but food safety often goes under the radar, as people are still not aware that little things often make a big difference. If food is unsafe to consume, it can cause foodborne diseases as well as injuries related to food consumption. To create awareness about food safety, every year, June 7th is marked as World Food Safety Day. To enlighten our listeners about the importance of food safety, we have Indian public health specialist, scholar, and Padma Shri awardee Miss Indra Chakravarti with us today. Indra, thank you so much for joining Akashvani. So Indra, starting with the basic questions, how should we define safe food and how is the consumption of safe food linked to health outcomes?
Food safety is a critically important thing. It is not only from the point of health, just public health, but also from the point of nutrition, also from the point of controlling disability, also socioeconomic development. All these are integrally linked to food safety. And since food can get contaminated by various things, by various microorganisms like harmful bacteria, parasites, viruses, toxins, even chemicals, and even radiochemicals at times. Just to mention, from a long journey from farm to fork, many of these can come in. Therefore, prevention of entry of these harmful elements into the food till it reaches the mouth of the consumer is the most critical concern, and not only a very critical concern, also a very difficult concern.
Indran, you mentioned about food safety being linked to disabilities, like unsafe food consumed can cause disabilities. Can you elaborate about that?
You see, if people have repeated infections, therefore a person falls sick constantly, there could be several disabilities that may occur because of that. And we now know that environmental problems, which is linked to food safety very critically, are the cause of many of the disabilities that we have now. Because of repeated infections, the body loses immunity, body gets more prone, gets more exposed to these problems, and it's all indirectly linked to some form of disability.
Okay, so Indra, to check that the food that we consume is safe, we need to be aware that these all parameters should be there for a food to be safe. How can we check that?
If you don't have safe food, as I just mentioned, it will cause diseases, it will cause infections, it will cause sicknesses, it will cause loss of nutrients from the body. Because if you take food and if you don't have food safety and if you are sick, it's like a leaky pot. You are putting nutrition from one side and you have diarrhea on the other side, it's all going out. It's of no use to you at all. So these are concerns which will lead to a lot of problem and cost. You need medical costs, medicinal costs, going to the hospital, going to the health center. It's a huge cost. And therefore, it's extremely essential that one needs to check when one is eating whether the food is safe or not. We all know that diarrheal disease is a problem, which actually we have got all programs, wonderful programs going. But even then, diarrheal disease still continues to be a very major problem in our country. And diarrheal disease, one of the major causes is unsafe food. Therefore, some of these diseases in public health, which we have not been able to control in spite of repeated interventions, some of them are definitely linked to, I would say, not only food safety, water, sanitation and hygiene. And all these three are very closely linked to food safety. Therefore, when you think of safe food, it is not only just the food, you have to link to the environment, the handling, the hygiene, the water, the sanitation. All these are very critical factors to keep the food safe. When we look into it, therefore, basically what we look into the food to check if the food is safe, whether it looks clean, it's handled cleanly, it is safe, clean ingredients are used, the water that's used being safe, the ice that is used being safe, the hands that touch the food is safe, the utensils that touch the food is safe, it's properly covered so that the food remains clean after cooking. That's one of the points of cleanliness and hygiene and water and sanitation. The second point is separated. We always say that the raw food and cooked food should be kept separately. Because once the food is cooked, it becomes hygienic because it goes through the heating process. But if you keep it back with the raw food again, all the infective agents that can be in the raw food might get ingrained into the cooked food. Therefore, we always say that please check when you go to eat anywhere that the raw food and the cooked food are not kept together. That's very, very. Third thing is cooking. The cooking has to be done properly so that any infectious agent in it gets killed. And after you cook it, it shouldn't be left out in the room temperature, especially the temperature that we're having now in this weather. One has to be very careful for how long do you keep it. Definitely not more than 2 hours. After that, either consume it within that time or you need to chill it.
The Food Safety and Standards Authority of India, which monitors that the food is safe, so how does it ensure that the manufacturers follow good manufacturing practices and good hygiene practices?
The role of FSSAI is to lay down science-based standards for food and regulate their safety at all stages, from manufacturing to storage to distribution to sale to import, so that safe and wholesome food is given to the consumer. That is the most important thing when we think of FSSAI's role. So FSSAI has got several regulatory measures. They have also a lot of courses that are going on hygiene practices, safety regulation. That depends on whether you are a manufacturer or whether you are a producer or whether you are just a seller or whether you are a middleman. So it's all different kinds of food, and food comes from not only at the manufacturing with selling points. You have five-star hotels at one end and you have street food vendors at that. The consumer gets the food at all levels from all kinds of food-based food establishments. Therefore, the entire process, there were different kinds of standards which have to be maintained for the different kinds of manufacturers, transportation, sale, ultimate sale. All these have different kinds of food safety regulatory standards which are given to, and based on that, actually, when somebody wants to open a food business operator wants to open a business, the different kinds of licenses, registrations given for different kinds of the level of the food establishment that you have, and they need to follow it. And to regulate all that, the FSSAI has a very strong setup in every state, and where they have these food FSOs, food safety operators, who go around and check. On FSOs, they have a regular method of checking, and they check and they report, and along with that, they give training or they penalize depending on which category, to which extent the food safety has been violated.
So Indraji, suppose, like you spoke to us about food safety standards that have to be maintained for roadside dhabas as well as five-star restaurants. So suppose there's a consumer whose health gets affected by consuming a particular food item. Then how can they raise a complaint if there's any issue with the food quality? And how can we generate awareness among the general public on this?
There are a lot of regulations, a lot of laws, in India that we have. I think if you think of laws and regulations, India is the foremost at the global level in everything, including food safety. We are one of the pioneers in everything, in formulating laws and regulatory practices. The problem becomes implementation.
Yes.
There are several problems linked to it. There's a huge number of population that we have. Therefore, the food safety officers in requisite numbers is always, every state has a problem of this, having properly trained manpower to handle it, which is very, very critical. So these are some of the issues which needs to look into it. So how do the customer react? Like, I don't want, if he doesn't have safe food. FSSAI has a dedicated toll-free number. It's 1800-11-2100. So it's a toll-free number that FSSAI has for customer care. Usually they prefer an online complaint because they can put it properly, where it happened, how it happened, it comes on paper, and they are supposed to take action on that. At state level, as a matter of fact, they are all help desks. Every state has a help desk, and the help desk actually is linked to a particular person. SSO is named. So if they go to the website of the FSSAI for the state, they will find that there is a toll-free number, there's an email number, and there's also a WhatsApp number. There are three numbers where they can link to a name of a particular person, who is usually an FSO, to whom they can link to.
Indraji, Health Minister Dr. Mansukh Mandaviya unveiled the 5th State Food Safety Index, which evaluates the performances of states and union territories on food safety. So what are the key aspects considered for Food Safety Index, and what are the main objectives behind releasing such an index?
I think this is a very excellent step that was taken, and states have started improving. If you see the kind of database, the number of things have been taken care of after this has come into place, there has been a remarkable positive shift. So I think this was an excellent step. And the State Food Safety Index, every state has it. And based on that, FSSAI even ranks the states. They have ranking of big states separately, the small states separately, of how they are doing with the Food Safety Index indicators. Basically, there are 5 significant parameters which the Food Safety Index covers very comprehensively. One is, I think, possibly the human resource they have. Number of trained people who can manage the thing, and along with that also whatever institutional database they have. But there are various institutions who carry out surveys, and we've also done a lot of them. So what are the survey methods? What do they show? This is something which is very, very critical to that. That is one of the main things. Compliance is the second index, that whether they're complying with whatever is being told to them. Are they complying? Not for a street food vendor, compliance is so important. They're sitting near a drain. You tell them, move out from this drain area, sit somewhere else. So it's a simple compliance. So these are compliances whether they're agreeing to it, or a big five-star hotel, they are maintaining something deep frozen for so many months or whatever. So some of the food they may regulate. So these are compliances.
Yeah.
The third thing is food safety testing.
Okay.
It is basically when whether the state has the proper infrastructure, proper technology, and whether it's being surveillance is being done properly, whether tested properly. So it's basically infrastructure and the surveillance method of a state. Fourth one is training and capacity building. So whether there's constant training because, new kinds of infections like COVID came in suddenly, though COVID had any role on food, but you don't want people to come in, too many people in one place, the less number of people, even if they come there, what should be their behavior? So I think different kinds of infections are coming, environment is changing, all these things are happening. Therefore, the training, whether there's training going on, proper training when they start, any food safety operator starts a business, is he being properly trained on what to do, what not to do? Is there in-service training going on time to time to do that? Is the training given to the regulators who are going and testing food? Are they adept of modern methods? Are they adept of how many samples to be taken under which condition? Which food are more critical, are more prone to infections? Which are not prone to infections? What number of samples should be taken for each one? All these details where the proper training is going on, along with the capacity building. And I think last thing was consumer empowerment. The consumer has to ask questions. Has to first of all see what's happening, then ask questions to the vendor, and thirdly, as you rightly asked me earlier, what do they do? They need to go somewhere and complain. So the consumer is very, very important that they take a proper role. It is they who are going to fall sick. It is they who are going to sort of get affected. That awareness on them, and if they have safe food, what are the benefits? If they have unsafe food, what are the causes? What are the things that might happen? So it's very, very important that the consumer participation in this whole process.
So, Indiraji, as you mentioned, it's upon the consumer to ensure that the food they consume is correct, and if they feel there's something wrong, they should raise a complaint. And in that context, the Health Minister has said that the Food Safety Department's revenue in 2022 to 23 through the imposition of fines for violation of food safety and standards has registered an increase of 193% more than the previous year. How do you see this?
Because this has happened, I think, with the better regulation, as you said, after the state food safety indexes has come out. Therefore, the regulation method has improved definitely. Because people know what to see, where to see. And therefore, I think all put together, there has been a very positive deviation when you look into it. There's a positive deviation to people's understanding on food safety. There has been proper training, and the capacity building has helped the people who are regulating to be more positive. Food business operators have become more aware now. And not only that they're scared of what's going to happen, but that intrinsically also they now feel that if the person gets sick coming there, they'll not come back there again. They're going to lose business. So therefore, I think all that put together, and that the business operators want to give safe food because of their own interest, plus because possibly they feel that safe food should be given, better training that's happened because of this to who are regulating the process.
So what more needs to be done to ensure that the compliance measures for food quality, as per the quality guidelines that have been laid down by FSSAI, that have to be maintained? Or how can technology be used to increase the compliance measures?
Firstly, India has wonderful regulatory laws.
Yes.
But to more critical use, more use of these is very, very important. I think consumer empowerment and consumer involvement, I think that's what we need to do more. Just not make them aware, but involve them. Yes. Maybe form groups, areas, and let the consumers be given some power so the consumers can take action, like what needs to be done. New, more effective instruments are coming out. They are faster, they're easier. Like now, if you leave it to a lab, it takes weeks for the results to come. Therefore, more technology so that, I give a sample and I get a quick answer for that. There are so many organizations give new technology awareness to people. So I think it's very important that technical people in the food safety group should be more aware of what is the technology going on.
Indiraji, thank you so much for your valuable information and insights in educating our listeners about food safety. I'm pretty sure that the listeners would now be wiser in knowing what they consume, and thank you so much for joining Akashvani.
Thank you so much.
You are listening to our discussion on importance of food safety and hygiene, issues and solutions. The participants were Indra Chakravarti, public health expert, and Ramya, anchor. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsdtalks@gmail.com or WhatsApp on 928-909-4044.